If you've been starting to feel something bulging out of your vagina, feel like maybe you're sitting on a tennis ball, or was just in the shower washing and felt something down there that you're not sure what it is, this video is for you. My name is Brittany Capiello, and I'm a pelvic floor physical therapist, and let's talk today about prolapse. Oftentimes for women, they will start to get vaginal pressure. They might feel like once in a while like they're sitting on something, or as the day progresses, they start to feel a heaviness down below. And a lot of times they're not sure what that is. Is it hormones? Is it something with their cycle? What's sort of going on down there? I have some women who even will say they feel like something's falling out of them. And then they get into the shower or they take a mirror and they look down there and they see something bulging and they start to panic. I've had multiple women come in to see me that had said that they found this bulge and they immediately were panicking that they needed to go to the ER or urgent care and calling their OBGYN, and they were scared because they never knew that anything could start to bulge out of their vagina. So let's talk today. What is that bulge, first of all? That bulge is called a prolapse, and any organ in your abdominal cavity can prolapse out of your vagina, okay? Now, that sounds a little bit crazy, like, oh my God, my internal organs are dropping out. They're not actually dropping out. So let's talk a little bit about anatomy so that you can get a better visual and understanding of what a prolapse is, okay? So this diagram shows the three major internal organs that are in your abdominal cavity. There's the rectum, the uterus, and the bladder. And then here is your vaginal canal, and here is your pelvic floor, which is your support system for all of those internal organs. If your pelvic floor starts to get weaker over time, and there's a lot of things that can make your pelvic floor weak: pregnancy, changes in hormones, diet, lack of mobility, trauma, injuries. There's lots of things that can influence your pelvic floor strength. But if your pelvic floor starts to get weak, what will happen is that these organs will start to shift around in the abdominal cavity, and sometimes what happens is that the organ can start to shift into the vaginal canal. Now, it's not the actual organ. It's just that the organ pushes down, and so the inward part of the vagina starts to bulge downward. I'm going to show you. This is sort of my normal drawing. This is my drawing of a prolapsed bladder. Okay, so you can see the difference here. So the bladder has moved and it has started to bulge in, making a narrowing at the vaginal opening. And so what women will see when they look at their vagina, or what they will feel when they're washing in the shower, is the bulge. And the bulge is this collapsing of the vaginal wall because the pelvic floor has gotten weak. Now, there are multiple reasons a bulge can start to occur. Increased abdominal pressure, intra-abdominal pressure, is often the biggest cause. That can happen with bearing down during bowel movements. It can happen if you've suffered with chronic constipation issues. It can happen if you've had a long labor and delivery where there were hours and hours of pushing. You can actually push and shift the organs out of place. Now, just like the bladder can collapse here, the uterus can also collapse downward on itself into the vagina. And the rectum can do the same thing, where it can start to bulge the vaginal wall from the back, okay? So any of these organs can prolapse. Your urethra can also prolapse. That's not shown on this diagram, okay? So when an organ starts to prolapse, what does that mean? It just means that that organ has started to collapse into the vaginal canal. It is not the need for, we don't need to have immediate surgery, you don't need immediate medical care, but you do need some help with pelvic floor physical therapy, because pelvic floor physical therapy can help to strengthen that pelvic floor so that the prolapse doesn't continue to keep prolapsing to where that vaginal wall starts to collapse, where it's actually dropping down outside of your body. You need to get that pelvic floor strong so that you can help keep that the pelvic organs lifted and help with those symptoms. Now, what I will tell you is that when you come to pelvic floor physical therapy, we're not going to have a magic wand that we wave that strengthens the pelvic floor and lifts all your organs back to this original position, okay? That's not going to happen. But what we can do is we can get your pelvic floor strong enough that the symptoms are able to be dissipated completely, okay? And you can also prevent any worsening of the prolapse. Now, I will speak from personal experience. I have had a prolapse of my bladder for the last 15 years, since the birth of my second child, and I have not had any symptoms. No pressure, no bladder leaks, no heaviness, no feeling anything sort of dropping outside of my body. because I do all the things that I teach you guys and I teach my members in my online community and the things I teach my patients one-on-one. I do all of those same things myself. So I'm not only a therapist, but I'm also a patient, okay? So prolapse is something that you can correct, okay? But you can't correct it in the sense of pushing it back up, but you can correct it in the sense of symptoms. You can alleviate symptoms. There are also devices you can use called pessaries, which can insert into the vagina to support the vaginal walls. And if you're curious to learn more about those and how they can help stop your bladder leaks, then go ahead and check out that video next on our YouTube channel. We'll be back talking more pelvic floor soon.